Bronwyn Gammy, the state-funded nurse, still calls at the school, but she's only allocated 1 day a week to meet the needs of 150 children at high risk of contracting respiratory diseases, skin infections and rheumatic fever. She has to rely on teachers to report health issues. So health problems are often not detected as quickly as they could be. Besides, so much of Bronwyn's work is involved in trying to cure kids. She simply doesn't have enough time to do the preventative work that would stop them getting sick in the first place. If you were in one school all the time, what would you do? What would be different?
Lots, because you'd have the time to do lots of health promotion, particularly on nutrition and physical activity.
You'd be examining the children more for things like skin diseases and things like this?
Yeah, they would, yes, most definitely.
It would also make sense if local doctors were paid to visit our schools. At his East Porirua clinic, Dr. Bryan Betty says that he's seeing far too many children who should have been treated much earlier. Bryan, what kind of infections and diseases are you seeing that are totally preventable?
Well, you'd have to say most of them. So I suppose a lot of what we see acutely are things like skin infections, chest infections, upper respiratory tract infections, ears, nose, mouth.
What about other diseases like rheumatic fever?
We see a lot of rheumatic fever in this area. For example, in the last 3 weeks, we've had 2 acute cases of rheumatic fever at the surgery, which have been confirmed.
And what will that do to that child?
Basically, once the child is diagnosed with acute rheumatic fever, you want to prevent further throat infections causing damage to the heart. So they need to go on a program of monthly penicillin injections, usually for about a 10-year period.
These injections aren't just the little ones on the side of your arm, are they?
No, the big ones on the backside usually, the penicillin.
So you get the big injection on the backside every month?
Yep, so it's 10 years times 12, that's 120 injections. And it needs to be in monthly in order to prevent a recurrence of what's called a strep A throat.
More than 20,000 children, mostly from low-income families, were admitted to hospital last year for respiratory illnesses and serious skin infections caused by poor housing and overcrowding. What's frustrating for you as a physician in this area? I mean, if you could fix things tomorrow, what would you do?
No, the housing. Yeah, insulate the housing, proper heating, and prevent overcrowding.
Can it really be that simple? How does bad housing make children sick? And what can we do about it?